Good morning. I think we're going to get started here because we want as much time as we can. Our presenter this morning, Starla Inman, is with us online. She's going to present through our Zoom connection, and we have a lot of other people on Zoom that we want to welcome. And this is going to be a session in which we learn how to connect. I don't know if you were like me, but when I hit a senior age, I became aware of so many people in my friendships and relationships that were facing situations that they needed information about care, about how to find services, and people who were in what we call the sandwich generation, where they have young children, but they also have their parents or their aunts and uncles who are facing situations they didn't plan to face and are now needing information. And so we're very fortunate in Minnesota because we have what we call the senior linkage line. And today we're going to learn about it and how to connect to find services. And I hope you will also realize that this is information you carry so that you can share it with people who are facing maybe abrupt circumstances, that they have a parent that needs help and they don't know how to get that help. With us today is Starla Inman, who is our presenter, and she's with the Southeast Minnesota Area Agency on Aging. She's a social worker and she works with this senior linkage line. And she's living in Rochester, whereas the offices are in the cities. She has been answering calls on the senior linkage line for almost 10 years. And prior to working with she worked as a nursing home social worker, helping with discharge planning. Starla will be reviewing how the senior linkage line can help you navigate the complex long-term care system, understand your Medicare benefits, and learn about your options for care in the community. And so we welcome Starla, and we also welcome all who are connecting with us on Zoom, and we hope we will have more people coming in from upstairs. So thank you, Starla, and we turn it over to you.
Thank you. Is everybody able to hear me okay? Can I get a thumbs up from Zoom, folks? Okay, great. Well, thank you for that nice introduction. Yeah, my name is Starla, and I work at the Southeast Minnesota Area Agency on Aging. And along with doing presentations and talking about senior linkage line, I also answer the phone line that we're going to talk about today. So what we're trying to make sure we can provide is, by the end of this session, we want you to understand a little bit more about who the senior linkage line is, what kind of help we can offer to you or a friend or a caregiver of somebody, how we can help, when we can help, and how you connect to us. So it's pretty simple. It's a phone number, but one of the things that I like to go over on this slide is that this 1-800 number that we're going to give out, that is the connection point for senior linkage line, is answered by specialists that are housed at various area agencies on aging. So it is a statewide service. Whenever you call that 800 number, you are always going to be answered by somebody in the state of Minnesota. And that can help people be a little more open to calling us when they realize that they're going to get somebody in their state that's going to be able to answer questions about their community in their area. So there are multiple area agencies on aging, and you can see them listed on this map. I work in the Southeast service area, but during my workday, I take calls from all over the state, as do other specialists throughout Minnesota. So there is no wrong person to talk to on the line, and we will forward you around or get the information from our colleagues if we have trouble coming up with it on our own. But again, when you call, you always get somebody from Minnesota that's going to be answering that line. The information that we offer is free, neutral, and objective. And this is really important because we do a ton of health insurance counseling, especially for people that are new to Medicare or considering options when they turn 65, what to do, which route to take, Advantage or Supplement. We are not insurance agents, but we are helpful educators about how the system works to provide you enough information to make your decision. There are times that people get a little bit upset because they want us to tell them the best plan or the best decision for themselves. We can't make that for you, but we can walk through some of the pros and cons of the different options that you have. So we do have a requirement to stay neutral. Same with if you were looking at a facility that you wanted to help somebody move into. There is no best. These would be the options. Some things are a better fit for different personality types and different desires for socialization than other facilities would be. So they're different. And our job is to remain objective and give you the facts, and the decision point remains your own. But certainly that conversation, if you've never had to make that decision, what should I think about? What kind of are the things I might be missing? Those are the conversations we can help with. So there are so many more services in our communities than people recognize there to be. And many of these services are actually funded through the Southeast Minnesota Area Agency on Aging, through Older Americans Act dollars and other funds like Title III funds, which go to support different transportation programs, as an example. So if somebody is deciding that maybe they don't feel safe driving anymore, but they're not sure what their options are, we start talking to them about, in the Rochester area, we have the ZIPS bus, we have the regular bus transit, but there's ZIPS if you need special transportation. We also have some volunteer driver programs through Elder Network and Family Service Rochester. And if you've never needed transportation before because you've always been able to drive yourself, that's something people don't know how to find, where to do it, who to talk to about it, and you can start with us. Regarding housing options, we talk to people about all types of housing. We have a large database that we'll see later in the presentation. It's called minnesotahelp.info. On that database, our data management team collects all of the licensed providers. All of the nursing homes would be listed in there. All of the assisted living facilities would be listed in there, and all the subsidized apartments. So sometimes we call those affordable housing. And that can be a great help for people that are trying to age independently, but maybe don't need that whole home and that mortgage or the upkeep of the property that anymore, and they want to go into something that's more of an apartment style, but may have limited funds. There is a shortage of affordable housing in the state of Minnesota, and the senior linkage line cannot fix that issue, but we can help you understand how to get on waiting lists, how to access applications. A lot of the people we work with are very uncomfortable being online, or they're not sure if they're downloading the right thing. We can download the applications and mail them to you if that's more comfortable. So those are all ways we can help. Regarding food, we do a lot of conversations about food support, or food SNAP, the Supplemental Nutrition Assistance Program. But not everybody wants to be on a public program to help them with food. And many people don't know about our Minnesota Food Helpline. So that's another place we refer people to. They keep tabs on all of the food shelves and senior programs for food boxes. They're called the NAPS, Nutrition Assistance Programs for Seniors. They keep track of all of that, how to connect to it, where it would be. And sometimes that one box of food per month can really help somebody that's struggling maintain their food budget and get good nutrition. We also talk to people about Meals on Wheels. So that is a really great service for somebody that's just starting to need some help, but maybe doesn't want a lot of activity in their home. Meals on Wheels can be a lovely program because they bring not only that warm meal, but that's a connection point on a daily basis with somebody that sees your loved one or sees you And if you don't answer and haven't canceled, they contact your emergency contact to see if they know what's going on. So it can be a good start to trying to get more help in the home. And it's a good way to kind of get that daily check-in. A lot of us don't live close to our families anymore, so that can be a nice way to do that. There are different programs that help with house cleaning. Family Service Rochester in Minnesota has a really great program that has that type of service. And you don't have to be writing down all of these. What you can hopefully remember and take from this is if you're looking for these services and supports, you can call us and we'll help you connect to them. Sometimes that's as easy as a 3-way call for us. And we kind of talk to the person that answers the phone about what it is you're looking for, what they can provide. And then when you're ready to jump into the conversation, you do that at that time. We also do a lot of connection to support programs. So there are a lot of peer support programs for people that might be dealing with caregiver issues. We have caregiver consultants throughout our region. Those are people that can help caregivers of spouses or other family members kind of try to make sure that they're also maintaining care of themselves. Being a caregiver for somebody can be extremely emotionally overwhelming and physically taxing, and caregiver consultants can help people find that balance. We have a caregiver consultant in every county in the Southeast regional area, so there is connection points to that. If you're not interested in meeting with somebody one-on-one, we have a really great resource through the state of Minnesota called Your Juniper, and these are evidence-based classes you can take in person or on Zoom. One of those classes in particular is called Powerful Tools for Caregivers. So that can be just a really good way to sort of try to wrap your mind around all the new responsibilities you have as a caregiver, but not lose yourself in the interim. Personally, I was a caregiver for my spouse before he passed from ALS or Lou Gehrig's disease, and caregiver support programs are near and dear to my heart because I've been in those shoes and I know how hard that is. So if people want to connect to those types of programs, we're happy to help you connect to them and know what they are. Sometimes that's the bigger issue, is not knowing that it's out there. So we help in a variety of times at point in times for people's lives, but we're really available at any point. Some of the main conversations we have with people are when they first turn 65 and become Medicare eligible. This can be really a confusing time for people in the United States simply because your Medicare eligibility is at age 65, even though your Social Security retirement may not be, full retirement may not be available until 66 and a half or 67. Additionally, a lot of people are working past age 65 and they don't know what they need to do. Do I have to take it? Can I decline it? What are these penalties I'm hearing about? How do I avoid them? What do I need to be asking? That's a great time to call us. Also, every year during open enrollment, we work with all people in Minnesota about the changes in the drug plans, the changes in the Advantage plans in different areas, and what's new for Medicare. So that's a huge part of our information. And again, it's non-biased and objective, but there are, folks that really don't know why they don't have Part D written on their Medicare card, because they don't realize it's always a separate policy, either through an Advantage plan. Last year in Minnesota, we had 28 Part D plans. This year, we only have 22. So there's been a lot of movement and shifting around that people didn't necessarily sign up for. Something might not have continued and they don't know what to do. That's a good time to call us. Also, right now, we are in the Medicare Advantage open enrollment period. It's from January 1st through March 31st. This means if you went into a Medicare Advantage plan during open enrollment, and in the first month or two of the year, you're saying, gosh, this isn't working how I wanted it to, or my doctor is not in their network. I don't know how I missed that. You have the opportunity to change to a different Medicare Advantage plan or into an original Medicare with a Part D plan right now through March 31st, so that you can have something different for the rest of the year. You can't make any changes right now if you are in original Medicare with the supplement and Part D, this particular period is only open to those who currently have a Medicare Advantage plan and want to either get out of it or change to a different one. But there are a variety of special enrollment periods that come around in Medicare. And if you are having issues with your plan or you don't know if you qualify for one, give us a call. It's our job to know all of these things. If you've ever been, if you've been in a nursing home recently, that's a special enrollment period. If you get a type of help called the low income subsidy through Social Security, that's another enrollment period that allows you to change your plan every 3 months. So there's a lot of information about Medicare and it's overwhelming. So if you want to talk to someone about your situation, what's working, what's not, what are your options, that's a great time to give us a call. Transitions, anytime someone's in a hospital or nursing home or assisted living, either moving out of or into, it's a great time to talk to someone from Senior Linkage Line to understand coverage, to understand options. And if it's something that you're not sure how you're going to manage it financially, we can walk you through how the government programs work that help pay for assisted living and nursing home. The care for a loved one, we've kind of already talked about. Prescription needs, we help research patient assistance programs and manufacturer programs for anybody that has prescription needs. You don't have to necessarily be on Medicare for us to help you on prescription costs. Minnesota has put in some new safety net features for insulin, where there are, that's the MinnesotaInsulin.org website, where pharmacists can help people apply for programs to get insulin at $35 for their month supply, where it used to be hundreds of dollars. So we can help people connect to those. Sometimes you have the Part D plan or Advantage plan that works perfectly for you, and then throughout the year you get prescribed something new from your physician and your plan doesn't work with that, doesn't cover that medication. We can help you look to see if there's options to a patient assistance program, a formulary exception. There's a lot of consumer protections that exist that sometimes people just kind of give up and think, well, then I just can't have it. That might not be true. And we would help you walk through that. We're also part of the Senior Medicare Patrol, and that means that we help people report fraud concerns. So if you ever have a Medicare summary notice, which comes quarterly from Original Medicare, or if you have an explanation of benefits from your Advantage plan that is showing appointments or things that you didn't go to, or you don't recall how this charge is being submitted to your plan, those are things that we can help you look into. And then we have particular forms that get filled out and sent to the state of Minnesota when we have concerns for fraud. So we can help you with that. You don't have to try to figure that all out by yourself. We do application assistance. Oops, sorry, I don't like my the one at a time. So if somebody is living in their own home or in their apartment and they're struggling financially, but they don't know where to go, we start looking at, okay, what about fuel assistance? If we got you on this program, would that help make some more room in your budget? Or energy assistance? There are programs through the state of Minnesota that are federal, and they're called Medicare savings programs. If you qualify for one of these, all of these have different income and asset levels. I would encourage you to call us or to make sure that you're looking at a specific Minnesota 2022 number for income and asset levels, because it changes every year. But the Medicare savings programs can help people by having the state of Minnesota cover their Medicare Part B premium. So for anyone on Medicare, that's $170.10 potentially back into your budget per month. That can make a big difference for people. On the Medicare Part D plans, there's a federal program through Social Security that's called the low income subsidy. Different income and asset levels than a Medicare savings program. These programs reduce your premium, reduce your deductible, and cap the copays that they're allowed to charge you on a Part D plan. Great program. Income and asset levels are very specific and static, but if you want to talk about if you might qualify for one of those, give us a call. We can give you the limits. If you think you might qualify, we'll talk about what you would need and we can help you do those applications right online. And again, on the prescription help, there are some manufacturer programs, but there's also certain charities that do help for diagnosis-based assistance, and they also have medication-based assistance. And there's some pharmacies like RX Outreach, which have income and asset requirements, but they allow for generic medications to be provided at a much lower rate. So those are all things that we can talk about and see if it fits the needs that you have. You can connect with us right now, primarily, I would say, by calling. And we're going to go over the number, but if anybody's getting anxious and wants to write it down, it's 1-800-333-2433. And we are open Monday through Friday from 8 to 4:30. This Monday, we are closed for President's Day, so just a heads up on that. We're closed for like federal and state holidays. We do have an office, so the senior linkage line that serves our area, the staff from SEMA, or the Southeast Minnesota Area Agency on Aging. Most of us are working from home, but we do have people in the office, and when we have some easing of COVID protocols, our normal was that people would just stop in at the Area Agency on Aging office, which is over by Costco off of Superior Drive. So it's like one street over from Costco where the movie theater is, Roosters, Mr. Pizza North, up by them. So there is an online function where you can chat with the senior linkage line. I'll be honest with you, that's a great option to get like simple information, but if you want to talk about your particular situation and what you need, they're probably going to tell you to call the line, just because it might be more in depth than what they want shared over an internet chat. So there's the phone number, and I believe there's some flyers or documentation that was printed off that may have that in your in-person options. But if everybody wants to make sure that they get this down, again, this number is for people that live in Minnesota, for seniors and their caregivers. We also have people that maybe their mom lives in Minnesota, but they live in Arizona and they don't understand our system. Then they should be calling us too. And they use the same number. So some of the things that, like maybe a daughter in Arizona would call us for mom lives in an assisted living and maybe she's running out of resources to pay privately, and they need to understand how to apply for county funded programs like medical assistance for long-term care. There's a specific application and there's a specific assessment that's requested from the county. And a lot of people don't know how to put those things together because our long-term care system is complicated. That's where we would come in to walk them through that process. There are insurance changes that are required when you have medical assistance in Medicare in Minnesota. We do the counseling for that as well. This is our website that we use. So anytime somebody's calling us and they're looking for these types of services, I'm looking for home care and I need help with bathing. For us, we understand that that requires a comprehensive home care license. And so we can look up all the agencies that have that type of license in a specific area through minnesotahealth.info. But that website is available for the public's use as well. It can be a little bit fussy because there's a lot of terminology that we use that probably you don't use in your regular day-to-day life. So if you struggle to find what you're looking for on here, give us a call and we can walk you through the search tools. There's the chat feature on Minnesota Health that we kind of talked about. There is a lot of information they can provide that way, but when we get into specifics about your particular Medicare issue or need for a family member, sometimes a list from Minnesota Health is not quite enough. You need to talk through with somebody what these different things are, so they may refer you to the line. We have a lot of print materials. All of our stuff is free. A planning ahead guide is something I want to focus on for just a little bit, because on March 8th, we have a paying and planning for long-term care presentation over Zoom. It's at 5:30 p.m. And it's all about like, how does somebody pay for assisted living when they need it? How do people pay for a nursing home? What are the programs that are out there? And when do you apply for them? And we're going to go over some of that in that class, but the planning ahead for your future publication can be really helpful to walk through how important it is that you have a healthcare proxy or a healthcare power of attorney. And for many people, how to set up a power of attorney for financial help if you're not able to do applications on your own. A lot of the applications for government programs require a lot of your personal information and financial records, which we're not able to get on your behalf. So sometimes we're working with power of attorneys on what do they need to get, where do they send it to, how does this all come together. But the planning ahead guide just is a good thing to have and to go through and make sure that you've really thought about who do you want to speak for you, and how are they close enough to you, or how does anybody know that that's your person to speak to you or speak on your behalf. The Medicare 101 is a great publication. It's a smaller version of our healthcare choices book that just kind of walks through what's a Medigap or supplement, what the heck is a cost plan, which in our region are only available in Rice and Goodhue County. What's a Medicare Advantage plan, and why do I need to be, what questions do I need to think about before I choose one? We have kiosk cards that are I think they seem to be everywhere throughout our community, but if you haven't seen them, it just gives a rundown of the different things that you can call and ask questions about: housing, health insurance, financial programs, community supports. And we do a lot of referrals to legal assistance. We are not lawyers, so we can't give legal advice, but there's also a great tool on the Minnesota Bar Association that can help you find a lawyer based on the specialty you're looking for. And you can even click on the fact that you want somebody that offers a free consultation. So if you don't know how to do that, we can do that website search for you and send you the results, but we can't recommend. Senior Linkage Line is part of a network, and that's what this last little 3-part, it's a magnet actually. So we have Senior Linkage Line, we do Medicare counseling for anybody of any age on Medicare and primarily focus on senior services. We have the Veterans Linkage Line. The VA and the veteran system is a whole nother ballgame of things to consider, discharge paperwork, things like that. So we have a special line that handles veterans benefits and things like that. And then for folks that might be under 65, not on Medicare, but they still need to connect to resources due to a disability, we have the Disability Hub. And in our region, those folks answer the Disability Hub phone number at SEMSO, which is right across from Shorewood, their offices. So that's the Southeast Minnesota Center for Independent Living. So, and if you call the wrong number, if you call us, but really you need to talk to the Disability Hub, we'll get you over there. So there's no wrong number to call. We can help you get to the right people, and vice versa. We get a lot of calls transferred to us from Disability Hub and from Veterans Linkage Line. So we are partners in helping people. So there's no wrong one to start with. One of the big things that happened this year is Healthcare Choices went completely online, which was a little frustrating for people. This is a 250-page magazine styled book that was put out every year by the Minnesota Board on Aging, and that's the overarching entity that tells the Senior Linkage Line what our functions will be. This book is still available, but it's online. But what we've done differently this year is if you live in Steele County, we can just send the pages that are applicable to Steele County to you. Or if you live in Olmsted County, we can send just those pages rather than a giant book that you have to filter through all of these. But what's nice about this is these have 1 to 2 pages of information on any of the Medicare plans available to the public in Minnesota that you can purchase. And they have the premium amount and copays for multiple services. In the Medicare and U book in the back, you'll see that out-of-pocket maximum, primary care copay, durable medical equipment copay, and one other thing, I think, like just a little bit. But this book has all of the plans in one spot. It's got all of the information you would want to know. What's the dental benefit? Because that dental benefit could be a reimbursement benefit to a certain dollar amount. It might just be vision. It might just be a preventative cleaning and an X-ray, maybe fluoride, or it might be more comprehensive than that. So this book lays out the vision, hearing, and dental benefits. And it also gives you a little bit more information on the different types of copays and what that particular plan charges. And also some of the extras are listed for discounts and programs. So if a Advantage plan allows you to use the Silver Sneakers benefit or One Pass, that's listed in here too. So it can be really helpful. So if you ever want this information, if you call us, we will send you the pages that are appropriate to the county that you live in. And you can view all of it for all 87 counties in Minnesota at the website there, mnhealthcarechoices.com. We're always looking for volunteers. So if what I'm talking about is something that you have been through, or you are thinking, you know, I could help people do that because I did it for my mom, or I'd like to volunteer and help people look at Part D plans during open enrollment. We are always looking for volunteers that want to work with older adults in the area. We're not a direct service provider, so we're not doing cleaning, transportation, bathing help, or anything like that. We're connecting people to those resources. And if that's something that you would want to be a part of, or helping with filling out some of the application forms, if you'd want to volunteer, you can call the LinkAge line, give them your area, and they will connect you to the volunteer coordinator. In our region, his name is Jerry, and he's wonderful to work with. Here's a little bit more close up for the other phone numbers for Disability Hub and Veterans LinkAge line. You can see disabilities number is very close to ours. So it's not uncommon for people to call one and really need to talk to the other, which is fine. I'm going to leave this one up so you can write this down, and I can share these slides as well with Pastor Kirkland if you guys want to get them to your forum directors, and that way there would be, you know, something that tangible if needed.
That's great. We'll pass that along. Thank you, Starla.
Okay. And now I just, you know, that's a lot, but it's a pretty broad overview of what we do and what kind of questions you could ask if you had them. And I'm wondering if you guys have any questions today that you want to ask me that maybe I can help with.
With the people on Zoom, if they would hold up their hands, maybe Starla, you can see them.
I don't know if I've got everybody on my page.
The people here in the audience, I will relay questions from them.
Okay, let me end my slideshow so I can see more people.
Okay.
Okay, I think I've got everyone. Does anybody have any questions?
Any questions here? The thing I think we can get from this is the many categories that you deal with. And it may have been overwhelming for us to know which category we would be calling on. I mean, I think the thing we need to think about individually are what are the issues that we are facing, or someone we know are facing, is facing, and know what we're calling about. But that number is the one you want to take home with you, because it's certainly a magic number, I think, Kirkland.
Absolutely.
You can call that number and have answers to these questions. So let's see if there are any questions in the audience here that we can put to Starla while we have her here. There's one online.
Tony, please.
Unmute me.
Okay.
Oh, hi, Starla, thank you so much for this helpful information. Just two questions. You mentioned you're only open Monday through Friday. So what recommendations would you have if someone needs to talk to a person on the weekends or after hours? Then the other question is, are you guys part of like this group called Age Friendly Olmsted County?
Yep. Okay. Yeah, so on the weekends, I mean, we're a nonprofit, so we don't have 24-hour availability. If somebody's looking for services on a weekend and they're not getting what they need, I guess I would hope that you could take a lunch break and call over lunch during the 8 to 4:30 just to try to at least get started with somebody on the senior LinkAge line. I can't change the hours.
Yeah.
Medicare 1-800 Medicare, the federal folks, they're available 24/7, but they're not as versed in the Minnesota specific information. And senior linkage line is again housed in the different area agencies on aging, and Dan Conway and Sherston Keeler are a big part of the age friendly initiatives throughout the state and throughout our region. So it's not me directly, but there are people from our office that are part of the age friendly programming.
Thank you.
Yep.
Starla, I would like to know, is this a state-funded organization? You just said it's not, the way I heard the answer that you gave to her. But is it, where is the funding coming for this? And when did it start in Minnesota? And is it connected in a national connecting system?
So the senior linkage line service is funded through state and federal dollars, primarily Older Americans Act dollars that come to the state, and then they give them to the various area agencies on aging to provide the senior linkage line service. There is not a nationwide version of us. We're a little bit unique. We had our 20-year anniversary the last time I was at the state fair, which might have been 4 years ago or so. So we've been around for a long time as a service, but as things change, it's grown as to what people can call us for, and the staffing has changed. So it is a little confusing because technically I am an employee of a nonprofit, the Southeast Minnesota Area Agency on Aging, but my job is to help provide the service of the senior linkage line, which is directed by the Minnesota Board on Aging. So I'm not sure if that helps. Every state has aging and disability resource centers or area agencies on aging. So there are a lot of people that work with us, and when they're moving, let's say they're moving to Texas, they want to know what number do they call down there. We can look those up. And usually there's an aging services division in every government for every state. And then you can kind of drill down to see if their aging and disability resources are combined or if they're separated. And there's usually a phone number, but if they're getting the same type of service, I'm not sure. That's not always, that can vary from state to state.
Thank you.
There's a question in the chat.
We have a question in the chat. I'll read it out loud so everyone can hear it. And it comes from Carol, who's on Zoom. When I signed up my mom, she was given a number and I was instructed to keep in a safe place. Why would I want to keep that number in a safe place?
So the only thing I can think she's referring to is a verification code. Did your mom move into a facility?
Carol, that'll be a follow-up question to you. You're welcome to type that in the chat, or if you want to unmute, yes, she says.
Okay, so the state of Minnesota put together a rule that anybody moving into a long-term care setting that's licensed as an assisted living, even if they call it an independent apartment, if their license is assisted living, you're required to have a verification code, which is a code number that we give you. It is a conversation that you had, or the person that was signing the lease had with a specialist, to make sure that they have the opportunity to go through home and community-based services if they want to. Sometimes people are moving because their family told them to and they don't really want to, but they don't know what's out there. So that's their opportunity to have that conversation. At the end of the conversation, there's a code number that we provide them. This is for moving into an assisted living in the state of Minnesota. That code number goes on the assisted living's contract. But let's say you move from Madonna Meadows to Samaritan Bethany's Arbor Terrace. Arbor Terrace is going to ask you for that code number for their contract. Once it's done, it's done. So you could, if you hang on to it, you don't have to call back and try to find out what it was and get it repeated to you. But it's good for your lifetime. But there are a lot of people that call us that called for their code, didn't want to talk about other options, moved into a facility. The facility does not accept anything other than private pay, and they no longer have funds to pay privately. And now they have to move again. So they'll call us back and we'll talk about, what facilities accept medical assistance, how to find those, how to get on waiting lists, that type of thing. But those are things we try to head off at the very beginning, that first phone call, to make sure people are asking those questions before they sign those documents and leases. But yeah, you do want to keep that number because it is used for any moves within the state of Minnesota for the rest of their life.
Starla, I thank you. Yeah, I think that helps. I have a question about timing. What I've observed is that people often wait until the crisis has arisen, and then they are really at a loss of how to get things in place quickly.
Yeah.
Could you speak to when is a good time to start looking at these various things in relationship to our own situation or someone we are concerned about?
Yeah, and I think the best way that I can do that is just by an example. My friend is 42 and she rolled her ankle and it ended up on a knee scooter last week. She lives in a standard split. So I think we should all be thinking, if that happened to me, how would I get into my house? You know, if I didn't have a spouse or somebody that was able to physically help me get up and down my stairs, you know, the ankle that was broke was one that's a driving foot. If you don't have a driver, who would you call? What would you do? I think these conversations need to be had long before anything happens. And that's just a hard sell. I mean, I had my loved one had ALS and we had to plan ahead because it took a lot of time to modify a home because contractors are hard to find. And if you're going to add a stair lift, you need an elevator license. And there's all these rules to modifying your place. So I think anytime somebody's aging in place, you need to think about, if I was alone here, or if I fell and broke a hip, can I get around in this space? If not, what kind of things could I put in place, or what's my backup plan? Would I go to my daughter's house while I recovered? Would I dip into my savings and pay for a respite stay in assisted living where they are a little bit more able to like they're built for people that have wheelchairs? What would I do if, for people that have some disease processes that are progressive, vision loss issues, what am I going to do when I can't see to run my stove anymore? And a lot of people might benefit from starting to bring in help before they need it 100%, just to get used to the idea of it all, because it is very overwhelming to have somebody come into your private space or to provide something for you that's not probably how you make it or how you would prefer it. So sometimes there's a learning curve to asking for help. But I think the biggest issue we find is people financially not being able to afford what they need as they age. Financial planners can be helpful with that. And physically, their physical living space not really being one that's conducive to age-related problems. If you had a walker, if you had to use a wheelchair, how would you get around your space? Do you have wide enough door openings? Is this a long-term place to be? There are so many different things that SEMSIL does. They can do, they have accessibility specialists, and that's like through Disability Hub and the Centers for Independent Living. But there are different types of hinges that are offset that can make a doorway that's not quite big enough open up even another 2 inches. Well, sometimes that can be enough to allow something to get through. So there are solutions out there, but they're often, the crisis planning is when people end up 2 hours away from their home community at whatever place had the opening. And that's unfortunate, but it's still worth calling to see, okay, goal is to get back home. What kind of things can we put in place and do to get them back to that space? What needs to happen? And everybody's, situation will be different, but it's a good thing to start that conversation.
We have a couple of questions on.
We do. So the first question on the chat that came in from Joel is, what can you say, Starla, about waiting list? Joel shares that his mother was on a waiting list at least 5 years, and he suspects that she fell off the waiting list without their knowledge.
I don't know. We don't monitor waiting lists, so I don't know much about it. I just know that they're real and they're out there. A 5-year waiting list for me sounds like somebody on medical assistance or maybe looking for affordable housing. The kind of disappointing but true fact is that if you're not on a government program, sometimes you have a little bit more wiggle room to getting into places because reimbursements are different. So facilities may have a certain amount of people that they can take in on particular funding sources, and others need to be private pay. So that can be a factor. You could always call the facility and find out where she's at in the waiting list. That's what we would advise.
And then are there any costs associated with waiting lists in your knowledge?
Not that I know of. I know that there can be like application fees or things like that that might be perceived as a waiting list fee. I guess I would have to talk to the facility that's saying there's a wait list fee to be more clear on that.
Thank you. I think that's helpful. And then we just have a comment, and it probably is something that you could speak to as well, but just how important it is for anyone to have an advocate.
Yeah. And we actually have a lot of people call that say, you know, my spouse passed, we never had any children, I'm not from here, I don't know anybody, I don't know who to choose as my power of attorney or what to, you know, I don't know who to do this with, right? And in our statewide, we have a program through Lutheran Social Services that they can be a paid power of attorney for somebody that doesn't have anybody to do that for them. So there are also some, you know, that's another thing I guess I could say about like, what can we do to plan? Keep a social network, keep at faith community network and your friends, and stay active and try to stay connected, because it's really challenging for any of us to feel alone and need help. And there's nobody we trust to do whatever it might be for us or to be that person for us. There are paid agencies that will step in and we can refer you to those, but it's always preferred if it's somebody that knows you and has a better sense of what you would want, that's speaking for you versus a paid service. And there's no charge to call Senior Linkage Line or to get referrals or to get information from us. There's no cost to talk to us. Lots of people talk to us every year during open enrollment, never again through the year. And then there's a lot of people that are making plans for a move, and they'll call us every week for the next 6 weeks until they get things sorted out, and then they're good to go for a while. So it's completely up to the caller how often they want to communicate with us.
Well, thank you, Starla. And there is a question here.
Yeah. So if they call more than once, can they talk to the same person?
Can you
Well,
hear-
yeah, I did. I prefer that, but that's not, the Minnesota Board on Aging prefers us not to give out our extensions. So we do have a tracking system tool where we put notes in our conversation so that anybody should be able to pick up where we left off. That being said, if I'm working with somebody and we're in the middle of something and it's not sorted yet, because I'm not allowed to give my extension out, what we'll do is we will plan for a future call where I will call them at a specific time that they've agreed will work, and then we'll move forward working together on something until it's sorted. But we are not, the specialists are not assigned as a one-on-one helper. We're kind of functioning like a call center, which is a little bit of a bummer. It wasn't always like that. Things change a little bit depending on who's running the show. So
Any other questions? Well, I want to thank you from all of us, Starla, for being with us today. You know, I think that knowing that there is a number we can call is really important. So I'm wanting to ask you to give the number again.
yes. So you can reach us at the Senior Linkage Line at 1-800-333-2433.
Okay, everybody get that?
Yeah, it's on the handout.
And it's on the handout we've had done. And those of the people who are listening in, if you have questions that you would like to, about the information on this forum, we do archive our forums so that we can listen or hear the information at another time. So if you think of someone who is not here today, has not tuned in, who could use this information, we can tell you how to get on the archive if you just call the office, and then you can hear it and watch it again. So our thanks to you, Starla. We appreciate all that you have done today to help us understand we're not alone in this process, that there are people out there who want to help us. And
Yes.
we think that-
I will send the slides to Pastor Kirkland, and there is a link for a survey. I don't even know what the questions are, but they are trying to make sure that people are getting the information they need. So I will send that survey link to Pastor Kirkland to pass around to whomever wants to do that. It's not required, but we sure would appreciate you giving your feedback. It helps us do better. And I will also make sure the slides get to him so that they're available.
Thank you again. And
Okay.
thanks to everybody who tuned in today. And next month, we will have another forum on the third Sunday, and it will be another information opportunity, because we're going to hear from United Way on a way to give information to people who may be looking for housing, who are homeless, and in other situations in town. This is going to be a new information for many of us, because we haven't heard what United Way is doing with number 211. So we're trying to get this information out, Starla, and you've been a big help today. Thank you.
Thanks for having me. Appreciate your time, everybody.